Welcome back to another lecture of No More Cavities. Today we will be discussing IV sedation. For IV sedation, the drug we use is midazolam, which is a benzodiazepine. How midazolam work? It acts on the neuroreceptors, neurotransmitters GABA. These are the neurotransmitters on which midazolam act. How much midazolam do we need? 5 mg per 5 ml. And where we apply the syringe on either antecubital fossa or either dorsum of the tongue. We use flumazenil 500 microgram per 5 ml to reverse the action of midazolam if it is given in high doses. So flumazenil is used to reverse the action of midazolam. How much flumazenil? 500 microgram per 5 ml. What are the indications of IV sedation by midazolam? The patient should be young and greater than 12 years. For patient less than 12 years, we require a separate sedationist. So the indication are young patient greater than 12 years, an unpleasant procedure, as we were giving nitrous oxide sedation, also an unpleasant procedure. If the treatment is too lengthy for GA, if the treatment is too lengthy for general anesthesia, then we will give IV sedation by midazolam. In ASA 1 or 2, which is a normal healthy patient and mild systemic disease. The contraindications are again divided into absolute and relative. The absolute are allergy to benzodiazepine, pregnancy, breastfeeding, and psychiatric illness. 2Ps and 2Bs: breastfeeding, benzodiazepine, pregnancy, and psychiatric illness. So 2Ps and 2Bs. The relative contraindication are if the patient is alcoholic or narcotic dependent, if there is hepatic or renal impairment, if there is increase in blood pressure, or if the patient do not have any escort. So these are indication and contraindication of IV sedation by midazolam. Now we will be discussing the advantages and the disadvantages of IV sedation. The advantages are that we can titrate to patient response. IV midazolam can be titrated rapid onset, amnesia, because patient will not remember the whole event, and that it can be reversed by flumazenil. So what are the advantages? That it can be titrated, it have rapid onset, amnesia, and it can be reversed by use of flumazenil. The disadvantage is that it cannot be used in needle phobic patient, because we are giving IV, so we cannot use it in needle phobic patient. A patient having respiratory depression, if there is any respiratory depression, we cannot use IV midazolam. And disinhibition effect, if there is longer post-operative recovery required, increased recovery, if increased recovery is required, we will not use IV midazolam. And because of amnesia, the patient may not learn to cooperate with the treatment, because however, this is the advantage, that the patient will not remember the whole event, but simultaneously it is also a disadvantage, because due to amnesia, patient will do not cooperate, patient will not learn how about the treatment. So needle phobic patient, respiratory depression, disinhibition effect, and if there is longer recovery period required, and because of amnesia, patient will not learn how to cope with treatment. So this was all about IV midazolam. Thanks for watching.